Okay, it looks like the numbers are not increasing as rapidly anymore, so perhaps it's a good time to start. And my iPhone says it's exactly 2 p.m. in Seattle, which, knowing that my iPhone is never wrong, it's 4 p.m. in Illinois, 5 p.m. in East Coast. And if anyone has tuned in from elsewhere, good morning, good afternoon, good evening, or good night, whichever is appropriate. We are going to begin with some words of welcome from Gary Langham, the Executive Director of the AAG. So I'll pass it over to him.
Hi, thanks, Mike, and welcome everybody. I just wanted to say how proud we are to host tonight's inaugural presentation of the Geospatial Fellows Program and to be a partner with Dr. Xiaowen Wang at UIUC and the NSF-funded Geospatial Software Institute, or GSI. And as you all know, geographers are critical to the development of new tools and data-driven solutions to fight complex problems like COVID-19. And that's because they work at the intersection of society and technology and science. And so the GSI and the Geospatial Fellows are so well positioned to advance our approach and to find these solutions to the greatest scientific challenges of the day. And we're looking forward to hearing from all the different fellows and to host more events just like this. And with that, let me hand it back to Mike.
Okay, let me just briefly say that I'm Mike Goodchild. I'm here because I'm part of this program. I've been in an advisory capacity, and I'll be making some comments after the main presentation. But now let's hear briefly from Xiaowen Wang.
Thanks very much. Can you hear me?
Yes.
Yes.
Yeah, thanks again, Gary, and also many thanks, Mike. Let me see if I could get my screen sharing going. My screen appearing?
Yes.
Awesome. Yeah. I'm delighted to have this opportunity to introduce to you our Geospatial Fellows Program and to kick off this webinar series with a particular focus on advancing COVID-19 research and education through reproducible geospatial science. And this link in the middle of my slide, you could click, and this webinar is recorded for you to view later. You will be able to see all the 16 fellows as part of this program. And the webinar series starting today is our first one. Will include a research talk given by Dr. Xiang Chen from University of Connecticut and his research team, and will be discussed by Dr. Mike Goodchild. You've heard from him briefly. And we'll wrap up with some Q&A. And this webinar series will continue through the spring and the summer with all the 16 fellows, their work featured. The Geospatial Fellows program supported by this Geospatial Software Institute Conceptualization project funded by NSF. The aim is to conceptualize a Geospatial Software Institute as a long-term hub of excellence to serve diverse research and education communities. A key deliverable of this project is, in fact, a strategic plan document. The link on the slide, you could click to see a draft of the strategic plan document. We're supposed to submit the final version of this document to NSF later this year. We would very much appreciate and value your input and the feedback. The Twitter hashtag here is one you could use to express your opinions and new thoughts about your work and about how you might relate to this effort. So feel free to take advantage of that hashtag. The steering committee members are listed here for the Geospatial Software Institute Conceptualization Project. As Mike mentioned, he's on the committee. Another member of the committee is also here, Dr. Anand Padmanabhan, who is the project manager for the GSI Conceptualization Project. He's also a key architect of the Geospatial Fellows Program. The GSI conceptualization process has engaged a variety of partners from academic and international institutions, as well as industry and government. AAG is one of our key partners. And also the partners contributed extensively to a number of our activities. Dr. Colleen Doney, who's the host for this webinar series representing AAG, as well as Ned English from NORC at the University of Chicago, and Diana Simpton have contributed extensively to making today's webinar series possible. This mission statement has derived from a number of discussions and community activities that says GSI, if funded, will help transform geospatial software, cyber infrastructure, and data science across many fields to revolutionize diverse discovery and innovation by enhancing computational transparency and reproducibility. I want to underscore computational transparency and reproducibility here because this is a key focus of our Geospatial Fellows program. Our vision statement is a sustainable social and technical ecosystem for GSI to serve for enabling geospatial inspired innovation and discovery. The community has worked together to identify these 5 goals. I'm not going to enumerate the statements on this slide, but again, to quickly highlight several key foci of the potential GSI, one of which is reproducible, transparent, and scalable geospatial software. Another one is ethical and open geospatial software. These are critical to, as we know, the fight against COVID-19 challenge, as more and more geospatial approaches get developed and applied to solving real world problems, and stakeholders and decision makers really need to understand how these different approaches could be repeated or developed and applied in different settings. Putting together the goals and the mission and vision into a simple diagram here, we're really facilitating two-way interactions between spatial thinking and digital transformation across 4 key areas, starting from the top, computation data intensive application and sciences. Going 1 level down is data science innovation, informed by the needs from applications and sciences. And from bottom to up, the advances from computing and cyber infrastructure, enabling the development of cyber GIS, both scientifically and technologically. And these 4 tiers of knowledge domains get synthesized and integrated through the innovation and application of geospatial software. That's really overarching picture of what GSI conceptualization is aiming to scope out. Give you some concrete examples from this more technical depiction of what GSI is contextualized. You see at the bottom some examples of high performance distributed computing resources linked together through advanced cyber infrastructure. The XSEED one is funded by National Science Foundation on the right, and Virtual Roger is a local example of cyber GIS supercomputing resources. And the middle multiple boxes and the links represent different modalities of cyber GIS software. The cyber GIS gateway is example to democratize access to advanced cyber infrastructure for enabling innovative geospatial applications at the top for discovery and innovation, many opportunities, as we know, linked to geospatial approaches. And this picture is transition to our approach in the Geospatial Fellows program for designing a community hub for convergent COVID-19 research and education. We are starting from the CyberGIS X platform, which is for sharing Jupyter notebooks linked to CyberGIS capabilities and the national cyber infrastructure. Now I'm going to highlight our Geospatial Fellows projects divided into multiple themes. One overarching theme is, as I mentioned earlier, is to reproduce COVID-19 research to establish the credibility of findings and accelerate policymaker adoption. This effort is led by Dr. Peter Kendron and Dr. Joseph Holler. So their work is to look at different research and education activities across our fellows' contributions and to understand the feasibility and the state of the art of computational reproducibility and what it means in terms of advancing their work through their different contributions and through their different methodologies. Another theme of the Geospatial Fellows work is on the methods side. Methods are pretty diverse, as you see listed here on the slide, including analysis, modeling, but also simulation. Today's talk I'm highlighting on this slide is given by Dr. Xiang Chen, really is focused on community health modeling at fine scale level and see how social distancing measures have a play in such modeling and understanding of the community health status. But also you see from the other fellows, the work on human mobility and spatial accessibility, as well as individual level bottom-up approach to epidemic modeling. So it's very diverse, even including contact tracing from social network perspective. So I'm really fascinated by this diversity and the richness of the work on the methodological side. The third theme of the fellows' work is focused on understanding impacts of COVID-19. So we understand this kind of impacts could be long-lasting. The work, for instance, focused on housing and eviction due to socioeconomic status of population, as well as, of course, COVID has caused significant mortality, but it's not even, right, across our population. And the unevenness is well reflected in socioeconomic and environmental factors, and certainly is also reflected in the transportation aspect. So all of these aspects, as you see from the fellows' work here, is quite well represented. The fourth theme is about assessing health disparities. In this theme, two primary aspects are covered. One is on food access, the other is on the spatial social disparities related to people with disabilities. So I'm going through this pretty quickly, and the link at the beginning, the first slide I showed you, has access to all the fellows' information, so you would be able to see in a more detailed fashion what these fellows are aiming to achieve through our Geospatial Fellows program. The fellows have started collaborating with each other since last fall when we announced the winners. We have put together a suite of resources through the contributions of the fellows. There's a set of blogs, more will be coming, but the link will give you access to a set of examples currently we have. We already are working on this platform, CyberGSX, sharing a set of CyberGS Jupyter notebooks for reproducing each other's work. And the CyberGS Hub is currently being designed to help host and share research and education materials contributed by the fellows, including data and the software. All of the fellows have access to a national cyber infrastructure provided by NSF-XC, including those with the machine learning and the advanced AI capabilities, and also Virtual Roger hosted at UIUC as an example of a CyberGS supercomputer. We've conducted multiple workshops. This link has recorded the past technical workshops. We might conduct more based on the needs of the fellows and also community input and feedback. So I want to acknowledge once again our partners for this Geospatial Fellows program, as well as for the GSI conceptualization project, as well as a couple of smart graduate students at the CyberGS Center for Advanced Digital and Spatial Studies at UIUC for helping make a lot of cool things happen behind the curtain. And of course, NSF, multiple awards supporting what we do here. Really appreciate the support from the National Science Foundation. So now I'm transitioning to the first research talk of this webinar series. The talk, as I mentioned, will be given by Dr. Xiang Chen at the University of Connecticut and his research team. Dr. Xiang Chen is assistant professor in the Department of Geography there. And his research interests are centered around GIS, community health, and spatial modeling with big data and artificial intelligence. So without further ado, I'm going to transition the Zoom floor to Xiang. Let me start the transition by stop sharing my screen. Xiang, please feel free.
Okay.
Yep.
Mm-hmm. Can you see my slides?
Yes.
Okay. Hello, everyone, and thank you for the great introduction, Xiaowen, and thank you for Gary for the great opening of. And so my name is Xiang Chen, and I'm assistant professor in the Department of Geography at the University of Connecticut. And it's my honor to give the first talk for the kickoff events of the Geospatial Fellow Program. And today I would like to talk about the project of our team trying to model the COVID-19 across the townships. And the subtitles of our talk is bringing maps, data, and models to the communities. Along with me is one of our team members, Adam Gallagher, and he's a Ph.D. student in our department. So before I start to talk about the research, I would like to proudly introduce our team members. So in this team, there are me and Dr. Deb Scotch, and she's an associate professor in our department, and Xiaolin Zhu, who is an assistant professor in Hong Kong Polytechnic University. Hui Wan is a postdoc in University of Idaho. And then we have some student members, including Aiyin Zhang from Clark University, Adam Gallagher, Ashley Oh, and Aaron Adams. They are the PhD students in our department. So we have gathered a team of 8 people and in different disciplines. So how did we get started? We know that COVID started in early March when it was announced as a national disaster. And then Johns Hopkins University has developed this dashboard to inform the public about the pandemic. And at that time, we are thinking, maybe we can develop our own dashboard on the local level and to inform the public about the outbreak in Connecticut. And at that time, all of the visualization work and the modeling work were very, very limited, not to mention them at the local level. And I have always been thinking this question during the early development of the COVID. So what are our geographers' roles in fighting the pandemic? We know that the virus is highly contagious in close contact and also has lasting impacts. And because of this nature, it varies, its impact varies across space and over time. And space-time is the 2 keywords that is addressed by the GIScience. And the impacts can also be physical and human. So I think as a geographer, these are the keywords. These are the three clusters that are in geography as well. And in GIScience, we're able to geovisualize spatial entities, and we are also able to model the cases. And these are the 2 major contributions that I think the GIS scientists can help with the COVID studies. And during this process, we have seen many related work. that bridge GIScience as well as health geography, including the study of health inequity, accessibility to testing, and also complementarity of vaccines. And there are different commonalities between shared by geography and the COVID studies. And I can use one word to summarize them, which is scale. The COVID is happening across space and over time, and I refer them as spatiality and temporality. And in the inception of the COVID, many of these studies are happening on the macro level over the entire country with this analysis unit being a county. This includes platform developed by Johns Hopkins University, CDC, Harvard Geospatial Center, as well as USA Facts. However, the mesoscale study and the microscale study is very, very limited. And then we see the Department of Health at University of Connecticut has published some COVID data on the state level for each town. So that's why we're trying to think about utilizing this data for our work. And also, there is a big difference between the mesoscale study, between the early outbreak and the inception, because in the inception, the transmission was through air travel on a global scale as well as the local scale. However, in the early outbreak with the travel ban over the country, most of the transmission were happening on the local scale. So it is very important to understand how the transmission was happening through intrastate spread in the early outbreak. And this is also the focus of our study. So now I'm going to pass my role to Adam, who will talk about how we geovisualize COVID in Connecticut.
Thank you so much, Joe. So the town level interactive dashboard to track COVID-19 in Connecticut is my piece of this larger project that Dr. Qian put together for our team. Next slide, please. So the first sort of Connecticut is experiencing the impacts of COVID-19 starting around March 8th of last year. A lot of the spill came over from New York City, which was like an epicenter in the United States for COVID-19. Quickly reacting to this, the Department of Public Health in Connecticut began releasing daily PDF reports of the number of cases at the town level. And this began around March 21st. Shortly thereafter, myself and our team that Peter has helped put together began collecting this data to put together the dashboard and begin curating a database of COVID data for Connecticut. The initial stages of this, the data was pretty sparse. There was really COVID cases and hospitalizations and cases and deaths at the state level. So the only town level, the only mesoscale data was COVID tests or COVID cases in the state. The town for New England primarily is a county subdivision. The reason town is more important, or this mesoscale is more important, is that there's only 8 counties in the state of Connecticut and there's 169 towns. So you can really get a much finer spatial resolution by using this county subdivision or this mesoscale to perform your analysis and to see patterns in the state. Later on, they began adding more details to their daily PDF reports. They began, the deaths per town, number of hospitalizations per town. And because of the, at the early stages, everyone's reacting how best to handle this data that's coming out every day. There's a lot of rudimentary data processing and data entry that happened at the beginning. Next slide, please. So here's a quick snapshot of kind of the workflow that I put together at the beginning. Starting in the top right-hand corner of the slide, we have the Connecticut Department of Public Health publications or PDF reports. And you can see the counties and then the totals for the whole state. And then below that, or in this case to the left, you have a PDF table of the towns for confirmed cases of COVID. Using an open source platform called Tableau, I was able to extract those tables from the PDFs with like a window and convert them into CSV files. Beyond that, those CSV files were then transformed into feature classes in a file geodatabase. And then those feature classes were then subsequently uploaded online to ArcGIS Online as hosted feature services, which were the ultimate end goal to utilize those and other tables published on ArcGIS Online to create the dashboard, which is over in the bottom right-hand corner of the slide. Next slide, please. So here we have a couple screenshots of the dashboard as it currently sits. In the top left-hand corner, there's a chart of the cumulative, of the daily cases, the daily deaths, and the daily hospitalizations over the temporal scale of this event. As you can see in the beginning, there was a large spike in hospitalizations and in cases. And because of that, the deaths are sort of suppressed, but you can still see that there is also a large spike in the number of deaths every day early on in the outbreak. Some are, sort of suppressed much of that. And then back when in the fall of last year, they began to climb again, and it was a much more sporadic, graph in the second half, that second wave, if you will. Below that, you see a tab. So there's multiple maps and graphs and information contained within this dashboard. And so we have the case rate per 10,000 people in the past 14 days. It's a moving window, 14 days. The change in cases from the previous day, and then also university locations in the state of Connecticut. The vaccination coverage for the state as vaccine data became available. And then the COVID cases, which you can see here displayed on the bottom right-hand side of this slide on the dashboard. Deaths as well, the daily change in the past 14 days, which is a graph, much like you see on this slide, but it's a moving window 14-day graph, so it's shorter. And then the number of COVID cases per 1,000 tests in the state, and then the daily graph as well. And that's kind of the entirety of the dashboard and all of its elements right there. So next slide, please. Here's some more screenshots. In the middle bottom, you see the testing rate throughout the state. And then on the two upper right and upper left sides of the slide, we have on the left, the number of cumulative cases in the state. And what I did is I picked on a town, Torrington in this case, to show that the pop-up, there's a interactivity within the dashboard, and this pop-up showing a bar chart of the cumulative cases over time. This is replicated, of course, with the cumulative total deaths in the state per town, in this example, Waterbury. Next slide, please. So, as I mentioned earlier, there was a lot of rudimentary data processing and data entry as everything was sort of unfolding and being figured out. As we were able to grapple and get a hold of the data. And as the Department of Public Health began improving their own systems of reporting data, there was improvements that were able to be made to help sort of semi-automate the process. A lot of it was through Python scripts. Again, adapting and evolving to the CT-DPH data sets, adjustments with things that we weren't expecting. For example, the 4th of July, they stopped reporting. And so you needed to now take an average over a couple of days. And now they've done it to where it's only updated every 5 days. It's not a 7-day update. Again, just trying to adapt to what they're doing so that we can provide data for everyone in the state that has, for everyone to look at COVID in Connecticut. Additionally, on top of that, through Experience Builder and Esri product, we were able to create 2 separate dashboards. A dashboard which you had seen in the previous slides for desktop users, and then also a dashboard that's more suited for mobile applications. And then through Experience Builder, we were able to create one URL link, one shareable link for everyone to access, and it dynamically adapts to the user's platform, be it a desktop or a mobile application. In the bottom left here, you see the CT data portal, which is now hosting all of the COVID-19 data resources. And there's no longer a need for that Tableau open software table exporter from PDF files. We can now directly download CSV files from the CT data portal, which helped with, the Python scripted semi-automated daily updates. Next slide, please. And then thank you so much for your time. Thank you for listening. And I will hand it back over to Dr. Chen to finish this talk.
Okay, thank you, Adam. So with the data collected on the town level, so we wanted to do more. We are trying to look at how the cases will evolve with a simulation model using under different social distancing metrics. So here we have considered and formulated the conceptual framework of the study. We considered that social distance is in 2 aspects. One is called compliance, which means if people are following the social distancing rules, and another is containment, meaning the level of human mobility. Then we use the percentage of people traveling and the max travel distance as a representation of those 2 metrics. And then, as you can see from the picture, the 2 aspects of social distancing will dictate the level of policy enforcement, which will have an impact on the transmission risk. We have incorporated the social distancing metrics into a classic epidemic model, which is called the SEER model. The SEER are the initials of the 4 phases of the 4 different populations in the transmission, representing suspectable, exposed, infectious, as well as recovered population in the transmission. So here is the full picture of our SEER model, and we consider that the mesoscale SEER model, or MSEER. And in this picture, we have the formulas, and in each formula, there are actually 4 different subformulas, and each subformula is a differential equation describing the change rate of the subpopulation. And it is worth mentioning that we are trying to incorporate the 2 social distance metrics into this formula, with CI being the compliance level and also the D0 being the containment metric. And we have used a half model to simulate the population traveling between towns. And then we have proposed the different social distance metrics with the 3 levels of compliance and the 3 levels of containment, which give rise to the 9 different social distance scenarios. In those scenarios, model 1 is the most substantial social distance level, and the model 9 being the least. And then we have incorporated the model with the 9 different social distance scenarios with data collected by the May 11th. And then we try to simulate the cases in the early outbreak until the middle of summer, which is July the 12th. And under all the scenarios, we predicted that the cases stabilized between 45,000 to 48,000 as of July the 12th, before the pandemic on July the 12th. And the actual case on that day was 47,000. So our prediction was, our prediction was very close to the actual cases. And we also have the prediction not only for the entire state, but also for the individual towns. And we also performed the model fitting and found that model 7 has the best fitting. And the fitting is better in urban cluster and urban areas than rural areas. And in this slide, we are showing the simulation results over each individual towns. So with this model, we not only simulated the infection rate, which means the number of infections per 10,000 population, but we are also able to indicate the increase rate, rate of increase, which means which town is likely to have a higher, which town will have a higher likelihood of outbreak in the future. And in order to verify and calibrate the model, we also launched a field survey to investigate the real-world travel activities. And the survey was actually distributed on Amazon's mTurk and was reposted weekly, lasting for a total of 74 days. And it is worth mentioning that we are still collecting the data on a weekly basis. So we have the survey results over the last half a year. And the survey questions included participant residential towns, if they will have performed inter-town travel in the last week, town to which they have traveled, and also number of trips. And the survey was also approved by Yukon IRB, and we used the survey results. We turned the survey results into variables into the model to calibrate the model. And with the survey and also the calibrated data, we are able to simulate the cases for the acceleration phase, which is in the fall and winter of 2020. And the results, unsurprisingly, is beyond our expectation. We have seen that our model actually was underperformed because of the spike of cases. And most of the underperformance happens around the early November, where we see a big increase. And we highly suspect that the big increase has to do with the national holidays as well as the presidential election in early November. And also the change of weather has also contributed to the sudden increase of cases. So our model was able to simulate the early outbreak, but it was not able to simulate the cases in the acceleration phase. And with all the geovisualization work and the case modeling work, we're trying to do more. we are thinking that GIS is more than mapping and modeling. It actually supports decision-making through increasing the public awareness. And I think this is also the aim of the geospatial program. And with this said, we have publicized our geovisualization platform as well as our modeling result through several media outlets. And our dashboard was launched around the March 22nd and published via various outlets, including the Yukon Geography website, as well as different social media platforms. And at that time, we got a lot of public interest, especially some of the towns in Connecticut has utilized our website and incorporated our website into their own website, their own COVID website. These towns included New Haven as well as South Windsor. And also Adam and Dr. Deb Scotch received an interview from NBC, and which also helped to publicize the dashboard. So we received over 143,000 views since March the 25th, with a peak of 5,518 on March the 31st. And it was covered in various news media coverage. So we feel that only by letting the public using the dashboard and knowing the result can the real value of our work be introduced. So still, we have seen that during this project, we have seen there are many misconceptualization of the map as well as the models. So one of the issues we realized by exploring other geospatial platform on the state level is a misconceptualization of cartography. And this is a work that is accomplished by one of our team members, Aaron Adams. And he had found that the CDC actually maps the data with unnormalized data in a choropleth, which is a violation of the basic cartographic rules. And on the state level, over 32 states, or 64% has maps unnormalized data in a choropleth. And they are also violating other cartographic principles, such as classification and the color scheme in their own dashboards. And we feel that a biased epidemic pattern arising from the web maps could have a lasting policy impact. So increasing the geospatial awareness of the general public, as well as the public health authorities are urgently needed. With the project, we want to call for future actions. One of there are several actions that are urgently needed, such as developing platforms and protocols for administrating and sharing of fine-grained COVID-19 data. And we can see that the data on the state level with the analysis unit being accounted are much available. However, the data on the meso scale, such as the towns, are very, very limited. So having these platforms could really facilitate the sharing of data and also future modeling work. And there's also a need to streamline the mesoscale modeling work for other states, as well as incorporating mobility data, such as the SafeGraph data, and compare them with our field service. And overall, we call for actions to increase the geospatial awareness of the public and health authorities, so which could eventually facilitate the data sharing and also the COVID modeling work. And we still have some ongoing work, including developing a reproducible geovisualization tool using the GSI CyberGSX platform. And this is currently done by one of our team members. And also we are trying to project future cases using the projected vaccination phases, rates, and acceptance level. And on the other hand, we have studies that try to use a national survey to study people's food procurement using Amazon MTurk to understand the human impact. And this survey actually has started in early May, and we have collected over 2,500 responses with over 75 questions. And also we are trying to look at the physical impact of COVID by exploring the association with extreme weather events, power outages, and spikes of cases. And so this is a list of our publications, and the publications of this talk is highlighted on the list, which is published in the International Journal of Geographic Information Science. And I would like to thank for the support of the Geospatial program, as well as some small grants from UConn INCHIP and Hong Kong Polytechnic University. And we also like to thank Cindy Zhang, our department chair, and Rich Marinsky, our lab manager, for support of the project, as well as hosting the dashboard service. And that's all my presentation, and thank you.
Thank you very much for that, Professor Xiang, Professor Chen, I should say. I'm going to make a few points in discussion, and then I'm planning to open it up for general discussion. And we have 2 questions in the Q&A currently. It looks like 3. So we'll pass to them as soon as I can. Just a few comments from me. Number one, I think that going to the town level was very interesting and has a lot of potential. Connecticut, of course, is very lucky in having a town level, but not all states in the US do. And particularly the ones in Connecticut do exhaust the space, they partition the space. Whereas a lot of other states have concepts like municipality, which don't necessarily partition space. But it was very interesting to be able to go to that level and to create a dashboard. Really, though, this project has two foci. One is the dashboard and the town level, and the other is modeling. And in a way, I'd like to talk about them separately, because one thing we can learn from what you've done is that creating dashboards and assembling data is relatively rapid, whereas modeling can be enormously time-consuming. And in COVID, this really creates a different situation for much of science, because science isn't used to moving very quickly. And it makes us almost jealous of geologists who have all the time in the world to study what they're interested in. I think that if I can focus for a moment on the dashboard project, it does involve human subjects. And so we have to think about how people would actually use a dashboard and what kinds of questions they would seek to get answers to from a dashboard. And one thing that always amazes me about the US is that the vast majority of Americans are quite capable of picking out their state on a map of states when only what is shown is outlines. They recognize their state by shape and by its adjacency to other states. This is not necessarily true of towns. And I wonder what percentage of people in Connecticut could actually pick out their town from a map when all the map shows are the outlines of the towns. That seems to me to be something that needs to be looked at if we're going to get serious about going down to a meso scale, as you've done. Another aspect of that, of course, is that if you think about why people would want to look at this map, one reason is perhaps because of where their children go to school or where they go to shop. And very often these will not be in the same town. And I wonder how many residents of Connecticut know the town in which their favorite grocery store is located. It's not immediately obvious that a large proportion of people can do that. So this is why I think a human subjects element to the dashboard would be very useful. What kinds of queries do people want to address to the dashboard, and what do they get out of it? And I think you've done very well to get as many hits as you have. That's very impressive. It would be, I think, very interesting now to look into why they're coming to the dashboard and what they're asking. That's the dashboard side. If I could switch now to the modeling side. One of the things I was mystified about when you showed me the slides in advance was where the mobility data were coming from. And I think the mobility data are going to be absolutely critical in this kind of modeling. They are difficult to obtain. And I noticed that in your questionnaire, you asked people which town they were going to. And again, to go back to my previous point, I wonder how many people can actually name the town they were going to. So I think anything we can do to get more data on mobility would be very useful. MTurk obviously is one approach. Another is to tap the kinds of data that are becoming available from the mobile phone data. Lots and lots of potential sources. I was very happy to hear your comment on choropleth mapping, which I've noticed also. It's become simply too easy to make choropleth maps of anything without thinking about the kind of variable you're creating choropleth maps for and the simple rules of cartography that you referred to. Another issue that I noticed with, and this must have been common in a lot of the work you were doing, was the small numbers problem. Because as you descend down to the town scale, the numbers, of course, get smaller. And what's more, you get a very frequent occurrence of zeros. And those zeros will mask and confound the results you get. It does mean that at some point you want to look seriously at Poisson errors because the Poisson distribution would be the appropriate one. You might also think about some kind of borrowing strength from neighboring towns as one way of dealing with the small numbers problem. But certainly as we get down to that level, we do have more and more awareness of the small numbers problem. And perhaps the last point I'll make is that I assume that the location you were dealing with, the recorded location, was always the home address. And that in itself raises an interesting problem, which is what to do about homeless people. It does create a bias, but also whether there were cases where the records, what was recorded was actually the hospital address or the address of diagnosis, a lot of other excuse me, possible ways of defining address. So thank you very much for that presentation. That's, I'm congratulations on having been able to move so quickly to get a very interesting project going. I do hope you'll stay with this because I think the modeling aspect is perhaps the most important from a scientific perspective, and obviously the one that takes the greatest amount of time. We do have, I believe, 4 open questions. And if I take them in the order in which they appeared, the first was from Naomi Lazarus. Are you aware of any challenges associated with data reporting at the township level in CT in Connecticut, particularly since Connecticut is administratively fragmented and towns, villages are largely independent? So perhaps you could offer any comments on that question, and then we'll go on to Peter Kedrons.
Okay, thank you, Michael, for your wonderful comments. And so I would like to first share my thought about your comments. And so you mentioned that in the dashboard, the people may have a misconceptualization of their towns. So I think you know, sometimes it's very hard to. So we actually thought about this in the beginning, because at first we only had a web platform, and then you know we feel that the majority of the people would not get access to the data and the cases using a web browser. That's why we try to develop a hybrid mobile and desktop version. And in the mobile version, when people, you know, when they open the platform, they're able to, when they know where they live and click on the name of the town, it actually zoom into that town. So that is the way we're trying to help them to, you know, locate their residential area if they don't know the Connecticut maps. The other question relating to the survey, which you mentioned, there are many different concerns. And those are also our concerns when we did the survey. So one concern we did have is about the human subject. Because when you ask people's addresses, there is not only a privacy concern, but also you know, it will go through a long process or IRB, and you know, COVID evolves over time very quickly, and it's very good, you know, the quick approval if we ask people's addresses. So we only ask people's you know, residential town, and without any address information. That's also get the approval process much quicker, and also ease people's privacy concerns. And I do think there are the travels, although we didn't use the mobile data for this data model verification, I think there is a potential to conduct the study using both data sets. And I know they have different advantages as well as disadvantages. We know that mobile data can give us a lot of potential in terms of the size of the data. However, the lack of the contextual information, such as where people are going and how many people are going, and also the purpose of their movement, is relatively lacking in those mobility data. That is why we feel using the survey data can complement that aspect. And lastly, I think Michael mentioned and the majority of zeros in the data sets. And this is also the issue we found in our survey. We found there are a lot of zeros in our respondents, where there are many towns, you know, with no respondents, and there are towns with a lot of, you know, responses. So this is also the issue we're trying to address, because of lack of responses, and which may be complemented by mobility data in the future. And
thank you. Naomi's question, you pretty much answered, but do you have anything else you'd like to add? It's in the QA.
Should I answer the other people's, the audience question?
Yeah. So Peter Kedron will be the next one.
Okay. So because when we collected the data, I think the data was reported by the Department of Health in Connecticut. So we didn't know who reported the data and how the data was shared from the local level to the authority level. So in this case, we are highly relied on the public data for the geovisualization and the modeling work. And I see that Peter has asked a question about how the COVID dashboard can be translated into policy intervention to address COVID-19 and insights. So I believe, we are trying to increase the geographic awareness as well as epidemic awareness of the public by publicizing our dashboard. And it is, we try to contact the Department of Health at Connecticut and try to share the evidence. However, we didn't get a response from them. So sometimes we feel it is easy to publicize our geovisualization platform, but there is still a way to go to collect our research findings with public authorities. So I think the first step is to increasing the public's awareness of the COVID by knowing the existence of the dashboard. And by doing this, the public can know, people in geography and are making a contribution to the pandemic.
I think Anand would like to add something. Am I reading that correctly?
No, I guess I just wanted to make sure that this question was being answered live. I was just...
Okay. Thank you. And we have an anonymous attendee makes a comment about MTurk. Perhaps you'd like to address that?
So the attendees ask, there are criticisms of using MTurk for gathering human input, as many of the users complete tasks with speed rather than accuracy. So are there any consideration of utilizing other survey platform method to reach a large pool of participants? This is a great question. So when use the MTurk, we use the managing platform MTurk called Cloud Research, which actually use the MTurk API. The advantage of using a third-party managing platform is to increase the accuracy of data and the quality of responses. Because on that platform, they will filter the participant by looking at their past history and accuracy of answers. So that will help to increase the quality of responses. And at this time, we believe the MTurk is the most widely used platform for surveys nationwide. And however, we know that MTurk is actually a platform for publishing the survey. It's not a survey platform. It's almost for publishing. So we feel it's a very efficient platform, and we didn't know other platform to publicize the survey.
Would you like to respond to the question from Zhenxi about interstate and intrastate travel?
Sure. So Dr. Xun Shi asked if we considered the intrastate between towns and interstate travels in the MCR model. So when we when we started the project, our assumption was that the intertown travel, which means air travel from external towns, are very limited. So that is our assumption of the model. So we didn't consider the intertown travel in our simulation model. However, our model is based on the intrastate or the travels between towns. So that is a very key variable in our model. And also, I think Dr. Michael Goodchild mentioned that we may consider, maybe there are some biases in the town on the edge that is next to, neighboring towns such as New York and Rhode Island. In reporting the result, we actually drop those towns in sensitivity analysis as well as geovisualization, because we feel those towns may be affected by the edge effect through the interstate travel. So with that said, by considering only the intrastate travel, it is less computational intensive.
Okay, thank you very much. I think looking at the Q&A list, we've pretty much come to the end of the people who've posed questions. I've not checked the chat, but there may also be comments there which perhaps you could follow up on. So it is a little after the planned end time for the webinar. I notice we still have 66 participants online. Let me at this point then just ask if anyone has any quick comments they'd like to make, any quick questions. Otherwise, I'll start the process of wrapping this up.
I think one of our team members, Ayin Zhang, has made some comments to the participants' questions, and Ayin is actually our modeler, and she has answered some of the questions, made the comments, and also shared a link with the audience, and you can get access to all our data and also the model and the scripts through that GitHub link.
Okay, and there is another question from Peter Kedron, if you could quickly look at that.
So Dr. Peter Kedron mentioned that there are a series of functions of model: organizational, normative, and constructional. So which do you think is closest to your model's function? So so from my personal point of view, I don't know the exact, the content of those models. I believe organizational seems to be the macro level, and normative seems to be the optimization model. So it could be constructional, but I can further check with you about the detail of constructional model.
I think you should probably follow that up, because I think the key word in there is function. It's about the purpose of the model. Is it to be normative? In other words, is it to design, or is it to deal with organizations and so on? So perhaps you could follow that up with Peter. Perhaps I could ask a related question. Are your simulations part of the dashboard? You showed them as images, but it wasn't clear whether they're actually available to the public.
So our dashboard do not include the simulation results yet.
Okay, because I think if you ever get to that point, there are some serious implications about how they will be used, how they will be interpreted. And I think there's going to need to be a great deal of caution in doing something like that, let alone legal issues. So let me at this point then thank everyone for attending, thank the 59 people who are still online, and thank particularly you and your team for an excellent presentation, an excellent start to this series, and thank the sponsors, AAG, and thank the UIUC team particularly for thinking up this whole project, bringing it to fruition, and creating something which I think is extremely valuable for the community. So thank you, everyone, and we hope to see you again at the next presentation in this series.
Thanks so much.
Thank you, everyone.
Thank you, everyone.
Yeah.